This is Dr. Bob McLellan, Medical Director and National News Director for Radio A1A Media Group. We've heard so much about the coronavirus outbreak, let's spend a couple of minutes talking about the virus as our knowledge has evolved. The coronavirus is a very common virus, one of two major causes of the common cold. Because of its chromosome structure, the virus is susceptible to genetic mutations. Some of these mutations, although uncommon, may lead the virus to behave differently and very aggressively. One of these mutated coronaviruses is the recent cause of all the hubbub. Infections from this mutated coronavirus vary from minimal illness to serious infection that can lead to death. People at most risk for serious illness are usually older than 60 years, often combined with other serious conditions like insulin-dependent diabetes. The virus is spread by person-to-person exposure through personal contact or with droplets from coughing or sneezing. The virus can spread before someone known to be infected gets symptoms. The risk of getting the viral infection increases with exposure to populations where many people are already infected, such as China, South Korea, and Italy. The combination of increased exposure to the virus by individuals susceptible to serious illness may result in deadly consequences. Unlike bacteria, treatment of most viral infections is often unsuccessful. So the best way to treat the coronavirus infection until we have a vaccine is not to get it in the first place. Older people or those with serious chronic conditions should isolate themselves or at least avoid places where they may be exposed to the virus, such as groups or countries that have lots of the infected population. Decrease spread by washing hands for 20 seconds or longer with soap or 60% alcohol. Avoid touching your face, mouth, nose, eyes. Avoid sick people. Cover your cough with or sneeze with a Kleenex, then throw the Kleenex away. Clean frequently touched surfaces at home or in a hotel with a household cleaner, such as doorknob, phones, TV remotes. Standard surgical masks do not help prevent infection with the coronavirus. Avoid traveling by cruising on ships. I hope this has been a helpful update on the coronavirus infection. There's more to come. Thank you.
Now, folks, coronavirus, COVID-19 has been all over the media and the news, I know, for about a month now, and you're probably sick of it. So we want to give you a capsule. This is going to take a couple minutes, but this is all from the CDC. It's not from any political party or anything like that. This is just common sense approach to taking care of yourself. Now, precautions to take, again, from the CDC. Avoid close contact with people who are sick. Kind of a no-brainer. Clean your hands often. Also a no-brainer. Wash your hands often with soap and water for at least 20 seconds. Think about it. 20 seconds that can save your life. Not a bad exchange. Especially after being out in public. If you're out shopping, doing whatever, just mixing it up. You know what? You come home, go to the bathroom. Wash your hands. Okay? If you are blowing your nose, coughing, sneezing, any of that, wash your hands. I don't know how many times I've said this over the last 20 years, but you know what? Flu season, COVID-19, coronavirus, Bob's ugly fever, whatever it is, wash your hands. If soap and water are not available, use a hand sanitizer that contains at least 60% alcohol. To the extent possible, avoid touching surfaces in public places like the elevator buttons, door handles, handrails, handshaking with people, that type of thing. Use a tissue. The elbow bump, that's a good one when you're greeting somebody. Use your sleeve to cover your hand or your finger if you have to touch something. You can also, just bring a handkerchief. That's a good idea. Start an old fad all over again. Avoid touching your face, nose, and eyes. I do this myself all the time, and it drives my wife crazy, but you know what? You can get over it. Clean and disinfect your home to remove germs. Practice routine cleaning of frequently touched surfaces, tables, doorknobs, light switches, handles, desks, toilets, faucets, sinks, and the most enshrined of all, cell phones. Lots of studies have been done about cell phones, and by God, the stuff that's on cell phones is just nasty. So, you know what? Take a little alcohol swab out, clean your cell phone off. Nothing to it. Use extra caution with crowds and travel. Now, this is a big one, folks. I just spent 10 hours on a jet plane in the last couple of weeks, and I have self-quarantined at home because of it. So, avoid crowds, especially in poorly ventilated spaces. Your risk of exposure to respiratory viruses like COVID-19 or the coronavirus may be greatly increased in crowds and crowded, closed-in settings with little air circulation. If there are people in that crowd who are sick, just bear that in mind. It's a little common sense again. The CDC recommends that you defer all cruise ship travel worldwide, particularly if you have an underlying health issue. Older adults and travelers with underlying health issues should avoid situations that put you at increased risk for more severe disease. In addition to avoiding crowded places, you should avoid non-essential travel, such as long plane trips. I know, I'm a dope. And especially avoiding embarking on cruise ships, preparing for healthcare needs. This is another important one, folks. Be sure you have over-the-counter medications and medical supplies like tissues to treat fever, aspirin, and other symptoms, Tylenol, that kind of thing, NyQuil, daycare, all of that stuff. You know what? It will all help you in the long run. Most people will be able to recover from COVID-19 or the coronavirus at home. I'm going to repeat this. Most people will be able to recover from the COVID virus or coronavirus at home. Period. Have enough household items and groceries on hand so that you'll be prepared to stay at home for a period of time. 10 days, 2 weeks. Old folks like me, please pay attention to this as well. Medicare covers related costs. Medicare covers the lab cost for tests for COVID-19. You pay no out-of-pocket costs for that. Medicare covers all medically necessary hospitalizations. This includes if you are diagnosed with COVID-19 or the coronavirus and might otherwise have been discharged from the hospital after an inpatient stay. But instead, you need to stay in the hospital under quarantine. Now, at the moment, there is no vaccine available for the coronavirus or COVID-19, but common sense and a little caution will go a long ways towards keeping you safe. Just about every human being out there is susceptible to the coronavirus or COVID-19. 80% of the people who get it will recover at home after a week or 10 days. 80% of the people who get it will recover at home after a week or 10 days. If you feel sick, stay home. Treat it like a bad cold or flu. Fluids, aspirin for your fever, and rest. Chicken soup. If you need help, call your county health officials or call your doctor. Remember, common sense. We're going to get through this, folks. For the A1A Media Network, I'm Mark Mills.